Okay, recording has started.
Okay. Cicily Talerico is an assistant professor of occupational therapy at Utica University. She is a proud Utica College alumna with over 20 years of clinical experience, more than 12 years as an adjunct lecturer, and over 20 years of clinical practice in various settings have equipped her with a comprehensive understanding of occupational therapy practice across the lifespan. Cicily's clinical and academic focus on mental and behavioral health, particularly in children and youth and community settings, has further deepened her expertise. This diverse background has enriched her teaching and service at Utica University and fostered research collaboration and professional relationships with the OT community. So I am thrilled and glad to have you present at our nursing education meeting, and welcome. And it's
Yeah.
all yours now.
Thank you, Joanne. Nice to be here today. I appreciate it. And thank you, Doreen Rogers, who has a office across the hall from me. So we talk quite often. Um, I'm happy to be here today. You reminded me, I'm actually running for trustee for the New York State Occupational Therapy Association, hoping that I get a chance to do that. Um, let's see, before I share screen, I realized today this presentation, I might have had a little too much on the PowerPoint, but I'll probably start in the beginning and just talk about some of the what is trauma. What I'm going to talk about today is trauma informed care for the classroom. I'm assuming everybody here is nursing educator, but there are 2 students. Is that correct? Okay. Um, just so I know who the audience is. And interesting enough, I was a therapist and for a long time before I was even introduced to trauma informed care. And I tell my students that now. I want to teach this to you now, because it took me too long to realize the importance of being trauma informed and having that lens. And I have to say, in the past 3 years or so, my students are getting more complicated. And there's been a lot more things going on in the classroom, and I don't know what it is. I don't want to say everything's because of COVID. I just think, people are changing. We're accepting of more things. Our students definitely are more diverse and more accepting, and more, sometimes more apt to talk about what is happening with them going on, and it's finding a little more normalcy in talking about our mental health and sharing that. So, some things that used to work don't necessarily work so much anymore. What can we do as educators in the classroom to help to support our diverse students? I know at least at Utica University, um, I think it's almost 60% of our students are eligible for Pell Grants. And that means that those students often come from, a lower socioeconomic status. And a lot of times those students are like our first generation students on campus too. So it's their first time, it's their first experience. And, we have a real mix of students, which is good. That's what we want. That's what we're striving for. But how do we support them in the classroom? So that's what I'm here to talk about today. Um, do you think I can share screen? I'm going to try here. I hope I don't lose anybody for a minute. All right, let me hit share. Choose what I want to share. I may or may not be able to see everybody. I'm not sure. Can somebody hop on and let me know that they can see this presentation?
We can
Yes,
see the
we can see it.
presentation, but it's
You
not in
can see it.
presentation mode.
Yep, let me do that. Um, we are going to, can you see me?
We can. You're over in the corner in the way I've got things laid out, and we can see
All
your
right,
presentation now in presentation mode.
beautiful. Okay, and I'm just going to let you all know I can't see any of you the way this is set up. If you have a question, please stop and ask. And you'll just have to unmute yourself. And I really want to have more of a discussion. I'll take maybe the first 10, 15 minutes just to set the foundation, and then we'll have a discussion. Oh, and then another side note too, as I'm listening to everybody, my grandmother was a nursing educator. And I was just telling Doreen, I really, she was 81 years old when she stopped working. And the only reason that she stopped working is because they called her into work at 81 years old. And she fell down the stairs trying to get to work because they were short staffed. So I have a true respect for nurses because you all are always there. And even at 81 years old, she got called into work and she was going. Um, so over 60 years as a nurse and nurse educator. So, okay. But anyway, so trauma informed care practices in education. All right. So first, what I want to do is just really define trauma. Trauma is individual. It's really what the person has experienced in their life. It can be different types of trauma. It can be like PTSD. Maybe there was one traumatic event, or it could be adverse childhood experiences, which can be cumulative trauma over a period of time in childhood. So trauma really encompasses lots of different areas. It can be from one event, it can be a series of events, it can be circumstances that have affected a person's life. Um, and whatever that has happened, that experience, it has an adverse effect on the individual's functioning, either their mental, physical, social, emotional, spiritual. Often all of those things are encompassed. Okay. All right. And most of you know, so some things that could be a traumatic event for someone is an abuse or neglect. Oftentimes, especially in childhood, it's that neglect or betrayal of a caregiver, especially at a young age, causes complex trauma disorder. Um, Even death of a loved one, a caregiver having being ill or having a life-threatening illness, domestic violence in a household, poverty, chronic chaos in a house, that traumatic stress. Um, Other things can include an automobile accident or other serious accident that they've experienced. Bullying is definitely a traumatic event. Anyone that's been bullied can tell you that they don't forget about it even many years later. And to my surprise, there's a lot of bullying going on amongst our students, and that I wasn't ready for, didn't expect, and I've been learning how to deal with that. um, but other things include like life-threatening health situations, medical trauma, medical procedures, someone that has been witnessing or experienced community violence in their neighborhood, a lot of police activity, or one of the ACEs, adverse childhood experiences, is having a family member that's incarcerated or having a family member that has a serious chronic mental health condition. Also, people that have been through natural disasters, people that may have experienced military combat, people that have had historical trauma or collective trauma. So there's lots of experiences that can happen in someone's life that may be traumatic to them and may affect how they function. All right, so just as a baseline, here are some statistics. And I think I can share this presentation with all of you if you want it, or I can even share it with Joanne and she can send it out afterwards. Um, but some statistics for our college students is, by the time our students reach college, so around 18 years of age to 21 years of age, 66 to 85% of the youth report that they've had some traumatic event. And oftentimes they've had multiple exposures to a traumatic event. What they found out through the initial adverse childhood experience study is that 60% of adults have had at least one adverse childhood experience, which can be abuse, neglect, a life changing event, a parent which is incarcerated or has a mental health condition. But often, I think it's 25% actually have four or more adverse childhood experiences. Um, our college students are particularly vulnerable to experiencing maybe a new potentially traumatizing event on campus. I even remember a young lady a few years ago that had a lot of traumatic stress happening in the household that she was living in with other students, and that was hard for her to process. Um, so they may be actually coming to college and having a traumatic event while they're attending. Some other stats is that female college students that have a history of sexual trauma are at a much higher risk for repeated trauma. That goes for males too. Some of our ethnic minority status and low socioeconomic status students, um, they often have a higher risk for maybe having trauma exposure. Not that anybody can have trauma exposure, but there's research to support that they may have had more exposure to trauma growing up. Having experiences that are trauma related, oftentimes a person is more susceptible to depression or have trauma symptoms. Just trying to make sure I'm staying on time here. And 4 out of every 10 children in the United States said that they've had experienced either a physical assault in the past year or an assault related injury. 4 out of 10, that's really high. So, what should we know about trauma and how are we approaching students? All right. So, like we said before, 1 in 3 have seriously considered thinking about suicide or have attempted suicide in the last decade. All right, and these numbers keep going up. Um, I don't know about where everybody is on campus, but we now, at least at Utica University, through our social work program, even though our health professions and education department supports it, but um, we now have a center for excellence that is guided through our social work program that for suicide prevention and education. Of course, we also have our wellness center where we have students go, but to provide that education, we do have that program now. So maybe your university has that similar type of program. You can look it up. Um, 1 in 5 experience maybe sexual violence in the past. And that's what's reported because we know that oftentimes those things do not always go reported or they don't go reported for a longer period of time. Um, and that we know that our LGBTQIA youth often face extremely high levels of stress, and they do face violence, and oftentimes that traumatic stress and violence that they are experiencing may create mental health challenge. Um, and actually, that's really how I got started in trauma informed care. And I forgot to tell you that is that I used to work at a children's and youth psychiatric center. Um, for a few years, and that's where I used before I worked there I worked in schools and with children and families, but it wasn't until I got to the psychiatric center and really started being trained in trauma informed care I realized how many children I worked with prior to that position that really were suffering from trauma, and really a lot of their responses, which we thought, oh, is this sensory, is this behavioral, thinking back, I'm like, oh my goodness, that was probably a trauma response. And I didn't know because I didn't have the education to know to recognize it. And that's what really why I like to do these presentations now and why I like to teach my students about it is because I want them to be able to 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 do what I missed and to be able to have that trauma informed lens. Um, so why do we need to be trauma informed? because happens everywhere. There's a lot of people that have been affected. There are students, there are coworkers, there are people that we're working with in the community. As nurses and OTs and PTs and health professions, we are, it may not just be the students that we teach, but it's going to be that the people that we're working with. And it's important for us to be able to start to recognize these signs and symptoms, and recognize, is this a sign or a symptom? And this is not just somebody being non-compliant. This is just not a student looking for an extension because, for whatever reason. So actually starting to look at maybe some of the behaviors and being open to maybe that there's a reason for them. And could it be trauma? So as educators, like we said, we're encountering our students um, every day, and we've had this discussion: is that our faculty really, even if they don't even realize it or not, we are on the front lines. We are in the classrooms every day with the students. We may be the first ones to start to recognize something's going on with this student. They're not themselves. They're not engaging as much as they used to. They're not getting their work done. They're looking a little bit disheveled. The student, I see them, putting their head down where they didn't before, or they're not getting their work done. They're walking out of the classroom. So it's important that as educators we start looking at that, and starting to wonder, is our student, are they okay? So um, so through an educator's lens, and we can read this together, but trauma informed practice is a framework, and it recognizes the prevalence of trauma and its impact on individuals. In higher education, it has become increasingly important to adopt these trauma informed practices, as trauma can significantly impact students' academic performance and overall well being, leading to a multitude of challenges that may affect their success in school. And that's what we're going to talk about today in a few minutes. Is we're going to hopefully have a discussion about what are we seeing out there, what are we doing, what can we do about it, and what the students, and we have some students, so if you don't mind maybe speaking up in a little while, we would appreciate that. So just recognizing that maybe what's going on is a direct result of some life experience that the student is having. Just quickly, here's some student groups that have elevated risks of past trauma experiences. So, of course, our vets, current and former foster youth. And I have to tell you, in the past 2 years or 3 years, I actually have had two students in the program that were students that I had in the Children and Youth Psychiatric Center. And both students have, I've never initiated that, but they've come to me and they're like, do you remember me? And I'm like, yes, I do. And I'm like, I'm so happy to see you here. So and there has been other students that have talked about that they have spent time inside of a psychiatric center. So I've had a student that was actually, that student will be graduating now, that came through the foster care system, that had some challenges for both being a student and for faculty too. And I don't mean to laugh at that. It was just, we learned a lot from the students. So they're on campus and they're in our classes. Um, so Native American and Alaskan Native students, our refugee students, our international students. I don't know where you all are, but Utica is starting to get more and more international students that come with actually they've been wonderful students, but they are saying like, I'm homesick or this has happened, and they come with their own set of some needs that we need to talk about a little bit more too. um, Students that identify as LGBTQIA plus, oftentimes they may experience some discrimination on campus. How do we support them? And of course, our non-traditional adult learner students, they're returning back to school later in life because of whatever barriers that they did not go to school for when at that traditional age. Um, and then our BIPOC students and co-workers. I'm gonna keep going. All right, so a little bit more reading and then we're gonna go into discussion here. So, how does this affect at higher education? Well, there's not a whole lot of literature right now. I think there's more and more, but there is definitely limited research right now on how college students are how their traumatic experiences are impacting their being successful in their education. But I did find there's a few studies out there. Um, this one looked at college students, longitudinal study from adolescent to adult, and examined the effect of childhood trauma experiences on college graduation rates. And what they found was um, continuing generation college students that had parents or grandparents that also had college education, and women. They both were associated with a greater likelihood of graduating college, but our first generation students and Black male students have experienced the worst outcomes in higher education and that have been at a higher risk for dropout. Another study, and I liked what they stated here. So, understanding trauma and trauma informed practices are a foundation upon which all other initiatives and strategies should stem from. Once the trauma informed culture in higher education has been established and initiatives that focus on resilience, mindfulness, everything else will follow. So I don't know. There's lots of you from around the state. Utica University does not have a policy on trauma informed care. We do not have mandatory training. In fact, I've brought it up for the last 2 years through our university, and it has always stopped with, well, let's do a presentation. But what I'm really fighting for is no, let's have it's part of our mandatory onboarding with all faculty, that this should be included. Is there anybody on this call that has a university that has trauma informed care principles as part of their mandatory trainings at their university?
I go to
So
Stony.
this, oh,
Oh,
And I
it's
can't
okay.
see anybody. I apologize.
It's okay. You can speak.
so this is Christina. I'm actually in the post licensure. I run nursing education at the hospital level, and trauma informed care is actually part of our nursing orientation.
I love that. And that's through the hospital?
Yes. So when the
Okay.
nurses come on, when all new nurses, regardless of if they're new grads or they're coming in with experience, part of our orientation is trauma informed care. That's a piece of. We also talk a lot about de-escalation and management of challenging behaviors, and it's all
Okay.
that's a big section of what they do.
Okay. I'm happy to hear that. I know somebody else was going to speak too.
Oh yeah, so I'm the student in this group. I go to Stony Brook University, and I was just gonna say that I'm not 100% sure if there is a trauma-informed foundation at this university, but I do know that when you were talking about the international students, I do know that Stony Brook University has a really broad amount of international students coming in, and there are specific programs that set up students that are from here, and they assist each individual student by themselves. So like they're they're better adapted to the university here and just the lifestyle overall.
Okay. Kind of like a mentorship
Yeah,
in
basically.
a way.
But I think it's
Okay.
yeah, I think it's really helpful.
Yeah, I bet it is. Anybody else? All right. So not on any universities per se, but not any mandatory training. Okay. And that's DEI initiatives. Like that's who I'm trying to really push DEI to become have trauma informed care training part of their when we do our DE and I mandatory trainings. We're going to get there eventually. But like this says, the evidence is clear is that there's a relationship between identity experience trauma and what happens outside of school as well as inside of the school. And oftentimes, the faculty um, are the people that are seeing the students in the classroom. So oftentimes we're the first people to start to recognize it. But a lot of, and I say this differently, well, I think that our health professions, because Christine, I think it was you, and I'm sorry I can't see anybody. I think because we're clinicians often first, is we have some of this training, but what about all the other faculty that does not come out of the healthcare system, like our arts and science faculty? That it was interesting when I did my first little spurt here. I was given 20 minutes to do trauma informed care through faculty teaching day. And so I bring it up and I'm like, oh, by show of hands, who here has ever been in a psychiatric setting? And the only two people in the room that raised their hands were two nurses. And then, like, for me, that was like, I realized, oh, I've always come out of healthcare, and, a lot of people have had this background, but not anybody else on this campus does. And that's why I think that this needs to be a campus wide mandatory training. Okay, I'm just going to keep going a little bit because I want to get to the slides in the back here. So I apologize if I kind of go through this a little bit. All right, so the 6 guiding principles of trauma-informed care. This has been adopted through SAMHSA. And we're going to talk about each of these in just a minute. So safety in the classroom, on campus, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, choice, and voice, and cultural and historical gender issues. So that's what we are going to maybe have a little discussion about here. So I just want to start to talk to you about trauma-informed teaching and learning principles. So the physical, emotional, social, and academic safety. I'll read this and then I have some notes here too. So in both the individual and group interactions, efforts are made to foster an environment that is mindful of the need for safety, respect, acceptance, including the opportunity to make and learn from mistakes. So anyone that has been in a trauma-informed care training, what is usually that first thing that they talk about? Oftentimes it's safety. All right. If someone has experienced trauma and they don't feel that they're in a safe space or in a safer environment, they are going to have a difficult time engaging in that space. So the first thing that we can do as educators is, how do we make it? We can't necessarily say like that our environment is a safe space, because we can't always guarantee that, but how do we make it a safer space? So you might see that term around, a safer space. Um, and I always tell the students too, it's respect goes both ways. I'll respect you. Let's respect you. Respect me. We have this respect in our classroom, and that respect is also being able to respect your peers. So one of the first things that I do in every class, and even we have a cohort model. So our students, actually, we have them for several times. Every semester I have the same group of students. But I've realized too, at the beginning of every semester and almost the beginning of every class to now, I have to set the tone of the classroom. These are my expectations. Do you all do that? Like right from the beginning of class, these are the expectations in the classroom?
We try
Um,
to,
my
yeah.
Yeah, my professors have gone over that right during like the syllabus week time. They really tell us, and we just listen to them like throughout the semester.
Yeah. I think it's an important piece, is to be able to set that tone from day one. All right. Um, and even now, like, it's the next week's our last week already. I can't believe it. And even today, we were having a student presentation, and every time I say, unless you are taking notes, we need to put our computers away and we are going to be respectful and listen to our peers. And it's I feel like almost you know I don't mean to sound condescending to the students, but I feel like I often have to make that reminder. to the entire class. And I have to feel as a faculty member comfortable to be uncomfortable, or I have to be able to take charge of that classroom, which I'm sure that you all do. And that is to help the students feel safe. Um, some other little things, I have some notes here too on this part is, are there ways to scaffold or integrate like low stakes assignments? Are we providing feedback to our students on their assignments? Um, can we adopt that authoritative teaching model, not authoritarian? All right, so we have to set the expectations of the classroom. We have to set the expectations of what is the appropriate behavior that we're going to expect. We have to be a model. So we have to, if you're going to talk the talk, you got to walk the walk. Do we have a model of being assertive and nonviolent communication style within the classroom? Can we review and discuss sensitive material? Do we provide content warnings prior to viewing? And do we provide a warm student teacher relationship? Um, Something about content warnings that I learned this semester, because I also teach in the mental health, is that I had a video in the shell that was essentially the content warning. It talked about what we were going to do for the mental health unit, and but I didn't realize till one of the students said, well, you didn't provide this content warning. And I said, yes, it was in the beginning. Well, when I went back into the shell, I realized that that student and many of the students never took the time to watch that video that I had into the engaged shell. So I'm realizing that if there's going to have that discussion, it really needs to happen in the classroom, between you and the students. Any comments before I go to the next one?
I had a comment, Cicely.
Yes, please.
I noted it more and more in the last couple of years, that there's a lot of stressors affecting our students. And, I find at the beginning of the class, and these are new students that we're repeating, some of these things that are supposed to be, respectful practices. Like I feel like the um the sweatshirt police, sometimes, and I say that kidding around, but they know they're
Yep.
not supposed to wear in the lab anything but a white lab coat over the, and I'm finding that, and it's the same students, it's almost like a challenge that, is she going to remember to say something about, why do I have to say, take off your sweatshirt? But I do, and it's almost like a challenging situation where they feel, I guess it gives them control over the environment. I don't know, but I've never remember having to do this so many times in the past.
Well, you're not alone. We have had a very similar discussion, because when we are the students are asked to dress a certain way for their labs, and sometimes they don't. So we actually have talked about posting. And I don't know, we may still have to make those reminders, but we've actually thought about posting, like, these are the expectations, and actually making a poster and putting it right on the door. And just saying, please check this before you enter the classroom. And it's tough. And I tell the students too, as faculty, these are the things that I don't want to have to follow you around to do. These are the expectations. But I do feel like we always have some people that, and coworkers too, that don't always follow those expectations. But I thought it would be helpful if they were in writing and if they're posted somewhere. And you can just say, as a reminder, these are the expectations that are posted on the door before you come in. Please check. And that's actually part of the something we were going to talk about too, is, are our policies clear? Actually, you know what? Hold that thought. We're going to go to the next slide. All right. So, because this is part of it, our trustworthy and our transparency, by setting explicit expectations, establishing consistency in practice, and keeping appropriate boundaries, and reducing disappointment, trust, and transparency are built. And part of this is, are we stating clear policies? I had a student, I don't know how many times we talked to that student about not wearing shorts to lab, but continued to do it. And then be like, oh, I forgot. And we're like, well, you need to put a pair of pants in your car. And next time you come to lab, we're going to ask you to go out to your car and change your clothes. And then that happened one more time, and they did. And I think, we didn't want that. And we don't, I'm not someone that is for public humiliation, because that is anti-trauma informed care, but definitely pulling that student aside and saying, that these are the expectations. I'm going to be consistent, and how are we going to follow this? And a lot of times, we have to, I know that the student has had these experiences, but they're going to go on clinicals, right? They're going to go on field work, and we're not going to be there to be able to say, hey, you need to follow these expectations. So I really have learned too, especially in the last year or two, is how do I gently put that back onto the student? How do I say, do you know the expectations? They are written down, everybody follows them. Can you find those? Can you find that list and read it back to me? So then I know that they know. And sometimes it's really pulling that student over to the side and talking to them privately. And then if it doesn't work, I guess you'll have to have a talk about, you know, what's next. But being able to be transparent, setting those clear policies. So students aren't looking for, well, the rubric didn't say that, but I'm being graded on this, or, having those expectations posted right somewhere in the classroom. Like, when you come to lab, this is exactly what you should be wearing. If you're not wearing this, then you need to go back out to your car and change. um, it's teaching them the skills to also be independent when they're out, after they leave us. Let's see. um, do we respond promptly to emails within 24 hours? And I tell the students I expect the same thing from them. Even if I email you, when you email me, are you looking for me to answer within 24 hours? Oh, yes, hopefully sooner. And I try to tell them, well, I expect the same from you. When I email you, I expect, for you to answer me back within 24 hours. It's a lot of training. Um, you know, Another thing about trustworthiness and transparency um, is trying to avoid those zero tolerance policies. I say within reason, though, within, safety. But can we create, like, my students, they all know my deadline, my oftentimes for deadlines for assignments sometimes ends up being on a Sunday night, but they know that they have 24 hours without me taking points off. That I allow them to still put in their assignment. And most of the time they have it done on time, but some of them might get it done like the next day, because I say, I would rather you go to sleep and be able to do this assignment fresh in the morning if it's like a reflection or something like that. But I've been very clear with the students too. Don't ask me for a long extension unless you have something that you can bring to me that you really need this. So, I don't really keep a zero tolerance policy unless it's like something for safety. I'm looking at the clock. I'm like, oh my goodness. All right. So trauma informed teaching and learning principles. So how do we make that support and connection with our students? How do we support their academic, interpersonal, and professional success? All right. Individuals and groups are linked with appropriate peer and professional resources. I like the student that just talked to about the international students and how they have a mentor. I don't, we are going to experiment next semester or fall semester, having some OT student mentors. So having somebody else that is going, because when we're going through an experience, we want to talk to people that have had the same experience and how do they help. So if we can do that, but as faculty too, how do we get the students connected to help on campus? I'm assuming that most of our campuses have a health and wellness center that have some, I know at least Utica, they have, I'm going to assume most schools do now, have a health and wellness center. We have counselors there. Everything's for free. Everything is confidential, and there is also, our school has adopted, there's a QR code, and it's like on every corner if you need someone to talk to anytime, 24 hours a day. Um, but here's another thing, I do want to actually have a quick discussion on this. I'm finding that a lot of our students that may benefit, at least in my eyes, from having some support across campus are not accepting of it. And that has been a real barrier. We have a student right now that I know that we want to support them, but they don't want to talk about things. They're like, nope, kind of shut down, and we're concerned. Um, so how do we? Students, they are adults. They are allowed to make their own decisions. But at least what I do, if I'm very concerned, and I've done this a few times, is that I've made a referral to our health and wellness center, and I'd sent the student an email ahead of time, and I say, I know you haven't talked to me in class, but I am concerned about you, and I have made a referral to you for the health and wellness center. And some students, the wellness center like reaches out to them. They send an email that says you've been referred, and some of the students respond back and some of them don't. And some of them had said, can I talk to you? Why did you send that referral? And I'm like, well, if anything, it got you now to talk to me. What is going on? So have you had some of that same experience where, students would benefit, but that you're finding barriers for them accepting some assistance on campus, even with learning resources?
Well, we had an issue. It was multiple faculty. I guess it was last semester with a student who there were specific mental health issues, and they were very concerned. And when the student manifested in the classroom with the behavior, the faculty member walked her over to the health and to the mental health services, or whatever we're calling it at our campus. And it was kind of contingent of her returning back to, because these students are in clinical facilities, and there was concern about behavior in the clinical
Hmm.
facilities. So it was contingent on that, and the student again insisting that the student was okay, and she clearly was not. And eventually the student had to withdraw from the course. But we do have an active student health services, mental health services. So that's what happened. And again, the student insisted that she was in some type of therapy, but she was clearly like manifesting
Yeah.
behavior that was not safe, that we were concerned about. So eventually she followed up. She's no longer in the program, but that's a whole different
Yeah.
issue.
Yeah. Well, the stress of school and clinicals and everything else that's happening sometimes can bring on symptoms too. So, anybody else?
So hi, this is Elisa. I work at Hunter College and Mount Sinai Hospital, and I have my own practice. So I agree. I think it's challenging because there's still stigma on really talking about mental health or
Yeah.
sexual assault, and it's very, very difficult. We had a case similar to what Joanne just mentioned. It was very challenging for me, and it was during COVID, and she lost some family. It was definitely such a tragedy. And it was very hard to pull her. Eventually, I got her into the wellness center at Hunter College. But it's very challenging, and you're right. I think these are adults, and sometimes we cannot say their name. We cannot force them to go. But we believe that it's so much for them. Just as a side note, we had two students actually. One of my former students did a huge project in maternity and labor and delivery about trauma-informed care at Mount Sinai. It was really an eye-opener. It increased awareness in the hospital because labor and delivery is such a sensitive and intimate experience, and if you have a trauma, sexual assault in the past, it can definitely have a major impact. So that was an amazing project, and I think we're learning more now about trauma-informed care. For me, to say honestly, it was a new concept when I've done it a year ago with the students, and now I have a PhD student that's doing trauma-informed care for his defense about LGBTQI, and probably will do a mixed method, qualitative and quant. So I think we see more of people being aware of trauma-informed care and being more involved, and making it a necessity to know about and address it in healthcare.
I agree with you. I definitely agree with you that it's, and it was nice to hear Christine say that the hospital is also teaching trauma informed care, because I didn't get my initial trauma informed care training until I actually started working in a psychiatric center, and by then I had worked with a lot of people already that probably had trauma and I didn't recognize it. So I'm glad that we're starting to see the benefit of having this lens. And it's sad to say that I've been fighting for 3 years now to get this really happening on our campus, and it's still not being incorporated. But I'm glad that you all are seeing the benefits of why we need to be trauma informed. I know time is of the essence at the moment. I don't know what's going on there. Oh,
Cicely, I thought you have one more person.
oh,
Jessica
oh,
had her hand up. You can't see her. That's why I'm telling you.
I can't, and I don't know what happened to my slides either. But yeah, please talk.
Hi, it's Jessica. I just wanted to share that I think this topic is so important. I actually just finished writing an article about trauma-informed care, um,
Beautiful.
and I came across this topic simply. I was working with refugee population in Greece, and that sort of started this learning process. But I think as educators, one of the things that I think we can do to help minimize that stigma is to really reflect on ourselves, right? Like,
Hmm.
and I try to do that with my students as well, to kind of normalize that. I mean, all of us have gone through this collective aspect of COVID, right? That was a trauma. It impacted us differently depending on
Hmm.
the privileges that we had, right? Like, for those of students who were working in a place where they didn't have Wi-Fi, that was more difficult, right? So I feel like sometimes we kind of bucket things, but I think if you just make it more natural that, you know, different childhood experiences, these are parts
Hmm.
of what make you who you are. And it's not something to shy away from, but really understanding that it impacts how you see the world, right? Like, your lens is different, and that's not better or worse, but it's just different. And I think that's something I try to emphasize a lot with my students.
Yeah. And I really appreciated that you talked about that, because that's what I'm finding is that people will be like, "Oh, I have to be trauma informed. That means I can't talk about it because I got to make sure I don't trigger anybody in the classroom." And I'm finding that may not really, all right, people are gonna, we don't know what's gonna trigger anybody anywhere. So how do we work with the students? Thank you so much. How do you work with the students to that this is my life experience, whether it was, whether I think it was a great life experience or a not so great life experience, it is still my life experience, and it has shaped me in whatever way it has, and here I am in the present moment in this classroom. And how do we respect that, and how do we have, and I've had a lot of issues with students, that's where I think our faculty is doing a fairly decent job, but oh my goodness, I'm finding that the students are not being tolerant of each other, and respecting each other's space and respecting each other's experiences. And I often find myself being the person at the front of the classroom that Jessica is saying, like, hey, we need to talk about this. This is happening in everybody's life. I appreciate you sharing that. I got about 1 minute left, so I'm going to cruise through for a minute. And what I'll do is I can share this with Joanne, and she can send it out. But working with the students, how can the students work in groups together in a collaborative manner, or working with the faculty. And a big one is how do we provide that empowerment, voice, and choice. So are we giving students certain freedoms in the classroom to make decisions that they need to make for themselves, and how are they developing that confidence and that competence to be able to be successful, whether it's in the classroom, on clinicals, or in life. um, there's lots of social justice stuff out there, that being responsive to people from various forms of privilege and oppression, and how do we support all students. And lastly, through trauma informed care is how do we support that resilience, that growth, and that change in our students? And how do we provide that positive environment, that positive reinforcement? How do we provide all students the opportunities for them to show their strengths and grow? Because through that, they'll start to build that resilience. So oftentimes it's really teaching the students those resiliency skills and having them work on it in our classrooms. And it's really hard when you're trying to teach academics, but you're also trying to facilitate resilience and working with students to make sure they're okay. And I have to say that it is difficult to be a faculty member and a teacher in front of the classroom. Whether we are kindergarten teachers, high school teachers, professors in college, I don't think unless somebody is in that position, they know how difficult of a job this is. Um, so I thank everybody, and I'll share this slide. I'll share it with Joanne. And Joanne, if you want to share it with your attendees, that's great. I'm sorry we didn't have more time to talk.
Well, I actually, it was
Contact
just
me.
a thing. I know that, if anybody wants to stay and take a couple of more minutes to ask any questions, I know that,
I can stay a few
you know,
minutes.
if anybody has to leave, I totally understand, but I'd love to see if anybody has any additional comments or feedback. Thank you for the wonderful information, and we could, you know, all need, additional, information to help reinforce, and that will be something that we can bring back to our campuses, hopefully, and say,
Yeah.
what are we doing for trauma informed care? Because it might be there, maybe we're not aware of what it's being called. So, but
Yeah, and Joanne, that's exactly, if anything today, if you just walk away with a little more awareness, like that was my goal.
anybody else have any comments or feedback?
Aliza? I don't know.
I was trying to take myself off mute. Thank you. I was just wondering, I don't think that we have a trauma-informed care, a formal program at Hunter College. And I was wondering, either the person that shared about the hospital, if you can share something, not the whole detail of the curriculum, but it's something that we can perhaps duplicate in our university, just to increase awareness of trauma-informed care, and make sure people are including it in their undergrad, in our undergrads and graduate. I need to check about the undergrad. I'm teaching mainly the graduate program, so I'm not sure if they have, if they include it in each specific in mental health and in each maternity and such. So I'll check, but I'm just wondering if there is something that you can share.
I didn't know if that question was for me. I think it was Christine
Yes.
that talked
Well, for
about
you
that,
as
right?
well, I think for you as well, I think for both of you, I think it's something you have done something in your university in Syracuse, I guess. But
Um, I'm just kind of looking it up. There's two universities that I often use their information. The first one is Oregon State University. They have a very nice trauma informed care program. I'd say that they are one of the first universities that really implemented trauma informed care throughout the school. So that is Oregon State University. And let me go back so I can see people. Another university is Buffalo. Anyone here from Buffalo? Buffalo State has a trauma-informed program also. And actually, I feel bad, I can't remember her name. I believe her first name's Carol. Oh, I don't have my notes with me. She is a social worker at Buffalo State, and I use a lot of her references. She does a lot of trauma-informed care for educators. And I can find that too. And it may actually have been on, hold on, I'm going back. That may have actually been on my, okay. I
Where
can
do you
push
see
this
that?
out right here in the slide. I'll send it out. I have a couple links: trauma-informed care practices for post-secondary education, the jedfoundation.org. Oh yes, and another great resource. Her name is Janice Carello. Carello. She is a professor at Buffalo, and that inform. I wonder. Hmm.
And
They're
what's
like,
excuse me,
yeah,
Sarah, is the other University Morgan State?
Oregon.
What's the other one you mentioned? Huh?
Here, actually, here, you ready? Write this down. You ready? It's education, education, Northwest, all one word. Education Northwest, all one word. .org. That will go to, that will give you that is a pretty nice packet. It's trauma-informed care practices for post-secondary education. It's a full guide, and that'll give you a lot of information.
Thank you.
And then, yep, and then the other person to look up is Janice Carello. Janice, Janice, Carello, Carello, and I believe that she is at Buffalo University. And she's got a lot of information on there about trauma-informed classroom for educators.
This is Giselle. I just added ACN.
Thank you very much.
Also has resources, so I put that in the chat too. They have a whole
Thank you.
toolkit.
Yeah, maybe I can. Here, let's see if I can do this. Let's see if this.
Is the information all on the slides, Cicely? That
It is. Yep,
and
I just put
that's what I
that
thought it said.
Education Northwest in there. There's a little I'll put these in the chat. Thank you for recommending. Yes, some of the information is on the slides.
Oh, good. So when you get it to me, I'll pass it along to the committee.
Yes.
Thank you.
But so thank you again for taking the time to really enlighten us, and for those that the concept is newer, that it's something we definitely as nursing faculty need to embrace and develop further, because as you said in your presentation, as I'm experiencing, we have policies and procedures, and if the student's late more than twice and they can't come, they get a half a letter graded, and but to understand sometimes what is some of these experiences that the students have that they bring into it, doesn't mean they can do whatever they want, but
Yes.
that there are multiple stressors and things that we can do certain things in a caring and a compassionate way, but yet to make sure that they know that there are policies and procedures that exist, so that everybody is, if one thing, we want to be consistent, and we don't want
Yes.
students to be wearing shorts to lab, but to recognize some of the diverse situations they come from.
Yeah, consistency is key. Consistency, expectations, having a routine, having that, individuality, but also knowing that, you can't wear shorts to lab because you can't wear shorts in a hospital. And that is, consistent throughout the program here. But when people are late, or something's not right, and, as faculty, being able to talk to them in private, and they'll share what they want to share, and sometimes they won't share anything, But if you know in your gut that something might be happening, make that referral, and
Yeah.
then it's on between the students and the health care people at that point too. But
Tara, I saw your hand up. I didn't want to cut off in case you had something as a last comment that you want to say. You get the last
Yes,
word.
thank you. Thank you. Thank you for the presentation. That was great. I actually, a colleague of mine who is not a nurse, she's actually in the legal profession, but she's in charge of a mental health part of her firm. We actually submitted to do a presentation at the ANA New York conference this year, so hopefully we'll get it. But I think this is a great topic to bring up into that presentation. I'm going to actually introduce it to her, and I'm going to use some of the resources that
wonderful.
because I think this is actually, it fits right into what we were thinking about presenting. So I actually might reach out if we have any questions,
Yeah.
just to pick your brain. So thank you.
Yeah, just go to SAMHSA and just type in the trauma informed care principles, and you'll get a lot of information. And trauma informed care principles are the same no matter where you go, whether you're working with children, adults, in mental health, in a school, wherever you are. Those principles are still, they're the same principles that we need to carry with us. So, well, thank you everybody for having me. I appreciate
Yes,
it.
thank you. And
Yeah.
enjoy the nice weather. Hopefully that just, and I will see everybody next month at our May meeting. So if anybody has